workplaces, it's often really not about competency. Rather, it's to what extent someone will successfully conform to these hierarchies or to the system and uphold the system. I see this in healthcare all the time, and I see it in clinical care a lot. Patients will be understood as good or bad patients depending on whether or not they are a good fit with the structure or the system. And providers will make sense clinically of patients depending on whether or not they're a good fit for their clinics. So I remember seeing, a number of specialty clinics when I was in training for psychiatry. And some of these specialty clinics would have very specific criteria for which people fit their manualized treatments. And, being a good fit or a good fit candidate usually meant that you would show up regularly, do a manualized treatment protocol, and then give good feedback for it. So maybe you were great for a research study, but, if you had hardships of any kind related to transportation or the lack of culturally sound services being provided, you would get labeled as kind of non-compliant or difficult or not a good fit, and you'd kind of be excommunicated from that setting.